as a healthcare professional, I was taught very early on that an error becomes a grave mistake if you don't say something about it.
Hello, everyone. I'm your host, Dr. Shafer of Talks with Dr. Shafer. I'm so glad you're here. I'm a physician, mom, life coach, musician, author, publisher, and I'm passionate about using storytelling as a tool to help you reclaim your story and build your most beautiful future. If you haven't already, make sure to subscribe to the show so that you don't miss any of our upcoming inspiring episodes with amazing guests who've reclaimed their stories and are building an amazing future for themselves and making a big difference in the world while doing so. Today, I'm so happy to have clinical pharmacist, speaker, and patient safety advocate Lidia Molinara on the show. Lidia Molinara has a mission to empower patients and revolutionize the landscape of healthcare through advocacy, communication, and education, or ACE. With over 3 decades of experience as a clinical pharmacist, patient safety officer, certified geriatric practitioner, and a former owner-operator of specialized pharmacies, Lidia Molinara has set new standards for excellence in healthcare practice, championing initiatives to prevent medical and medication-related errors, which is so incredibly important. Lidia, thank you so much for joining us on the show today.
Well, thanks for having me. I'm excited to have this conversation with you.
Me too. Before we came on air, we were just talking about all of the reasons that we're so excited to have this conversation today and to spread this information because it is so critically important. Now, you have been a champion for patient safety and education for years. What inspired you to first become a pharmacist and to focus on advocating for patient safety on a larger stage?
I think I started when I was really young because I was kind of my mom's, in the sense, interpreter. And we had gone to a pharmacy, and the pharmacist there was excellent, explained everything, but really put in my mind at that time that taking medications, it was really important to follow the instructions or things could get worse. And I don't know, I think it just sat there in the back of my head. And then years later, when my sister became a pharmacist, we sat down at the kitchen table and she's like, "You love biology and chemistry. You should think about doing this." And at the same time, I was working at a drugstore and I kept thinking, how does anyone remember all these drugs and what they do? There's so many. How do these pharmacists remember it? Let alone the over the counter shelves and shelves of medications. And I just got inspired by all of that and thought maybe this is something I want to do. And then shortly after, when I was in my fourth year of pharmacy, I ended up passing gallstones. But I had passed 7 of them before someone figured out I had problems with my gallbladder. And I can remember really just having to, in my own self, be like, something is wrong, and I can't keep getting this Malox and lidocaine mixture called Pink Lady to drink to solve the problem. So I learned myself that I had to speak up, and it was okay to speak up and really explain what was happening to me, because from one doctor to another, in the sense going into a merge, it's chaotic. I'm just presenting with heartburn. It was difficult to put the pieces together, and it was my responsibility to really explain my story properly. And I feel like once I did that, and once I learned to speak up, and once I learned the process of that, it got better for me. And then that carried throughout my entire career as a pharmacist, but also as a mom. When I was dealing with my kids and I had problems in the sense of with their health, and I had to really keep grounded and focused and learn. And I think it's through that I've realized, and then 30 years on top of that, of listening to stories and seeing people's health and family members, working in long-term care and seeing that environment. It's really been important to let people know, even now more than ever, that us as healthcare professionals, we have a certain set of responsibilities, but the patients themselves, the more information and the better equipped they are in navigating the healthcare system, the better the result and the decrease in errors and preventable errors that can happen to them.
That is so incredibly important and empowering. I think, especially when you are a patient who doesn't have medical background or even one Who does? When you are coming onto the field as the patient, it's a different experience and it can feel overwhelming. And sometimes you want to just throw the ball to someone else and do, this more older style of medicine where I say, I will do what the doctor tells me, or I will do what the pharmacist tells me, what the specialist tells me because they know better. But actually, you are the expert in you, and they can only go so far without you being their partner and helping you on that healthcare journey. So that's incredibly important and empowering. Now, what do you see from your own experience as you were kind of reclaiming your own power as an advocate for yourself and your family in the healthcare sphere as potential barriers between a patient feeling empowered to make sure that they are being an active participant and decision maker in their healthcare?
Well, I think it really does come down to the three key principles that I teach. It's the advocacy piece, the communication piece, and the education piece. It's those three pillars. So when you look at trying to advocate for yourself, you really do have to remove any barriers you have with fear or I don't know enough. How could I ask? That's where you go back to the pillar of education. So, when I was going through things with my daughter, she was 9 months old. I was a pharmacist. I knew the calculations. But today we're in a world where you pick up your phone, you can Google a drug and see what the normal range for that medication is. You can do things through, the internet, through resources that you can get, way back when, what were you going to get? You were going to go to the library and get a book to look up drugs or look up a disease state. But when you're speaking to a physician or a pharmacist or a physiotherapist, any healthcare provider, think of it not like they are the all knowing, the almighty, but rather that you're a partner. They're your guides and they're a partner in your healthcare journey. And I think that shift in mindset is really important because you don't feel like you should question someone who is of higher authority. And we often don't, right? You get taught that in classrooms where it's like the teacher sets the rules, you stay quiet. But in healthcare, you said it best. You are the expert of your body. You know what's happening. Nobody can feel what you're feeling. You have to describe it. And that's where the communication piece comes in. The barrier to advocacy is knowledge and communication. And you have to just remove the mindset of being inferior in that conversation or not on equal ground, because you are. In fact, I, as a healthcare professional, want the patient to tell me things. As I'm filling prescriptions or as I'm, giving an injection, I need you to tell me that you've had allergic reactions, that you've, had an issue where you're scared of needles and they make you feel like you're going to faint. Those things help me do my job better and make sure I don't make a mistake. And so that really is a mindset shift. I look at it like, when you have to renovate your kitchen, you had a flood, there's a big catastrophe, something was not expected, and now you walk in and your kitchen cabinets and your kitchen is ruined. You make a process, you make a plan, right? You start to do your research. What kind of cabinet color do I like? What's the latest hardware? You do all these things. So when you're doing all these things, you feel empowered to pick your own kitchen. Well, why is your body any different? You're picking what you need in the sense you're going to the specialist. And I know there's managed care and you have a process of having to navigate that and go to where they tell you, but you have the power to talk, to express what you're feeling, to record things, to do that homework, because you do it for your kitchen. You're going to look up things and resources, then do it for your body. And of course, prevention is key. We always want to try and avoid going to, situations where we have a disease state that's then a chronic condition. But there's situations where we get hurt or, like you sprain your ankle, you break your ankle, and there's a decision about whether you want to operate on it or, you have to get your information clear. And so then when you do get the information from the physician or the pharmacist, take it back, review it, feel comfortable with things, go back and ask more questions, really understand what you and what your direction needs to be because it is your body after all.
So much to unpack there that's so important. I think making sure that you understand that it's a level playing field, if not, you have the upper hand because you have a lot of information that I, as a physician, don't have that I need. I need that data to make good decisions, to present to you your options. So, diving into something that you were discussing about, the choices you have to make, I'm not telling you what to do. I'm giving you options, and I need to give you the advocacy part where you said about making sure the education piece is there. I need to give you the information to make the best decision that you can. Now, we know that unfortunately, even when we're all showing up and wanting to do the best for our patients, whether it's when we're prescribing a medication or it's at the pharmacy level and it's being dispensed, we know that there is a high risk of having an error there that could potentially put the patient at risk. And the last I checked, this is actually the most common error. And it's not necessarily like we said at the pharmacist level. It can happen anytime from when we make a decision about what medication we are considering prescribing to when the patient is given the medication, or even potentially when they're taking the medication at home or in the hospital, if that's where they are. And so when we understand that there is a high risk for errors that could negatively affect the patient potentially, we have to be really open and honest about the fact we know that those can happen and empower patients to speak up when they have questions. The last thing we want is for you to make assumptions about what you're taking, or for us as people as a part of your care team to make assumptions that then lead to us kind of filling in the blanks, things we don't really understand. And then we can't take back what happens if maybe we take too much medication or we miss doses and it's a medication that you could potentially have a withdrawal type syndrome from, that sort of information. So when you are going to see your pharmacist, ask those questions. Please feel no shame or embarrassment. That's a wonderful opportunity. You're not questioning authority.
Hmm.
You are checking the system, making sure that you understand how you're going to take this medication. So I really appreciate you laying that out for people.
Well, and on the pharmacy side of things, medications need to be taken following their rules as well. And so you have an error that can happen from the prescribing. And I'm not saying that it's the wrong drug necessarily, but I've filled prescriptions where it's written as, because sometimes the computer system will pick the wrong strength when you're filling it in. I mean, it
Mm.
can happen. No different than when I'm filling the prescription. When I go to put in the drug name, I pick 200 milligrams, but it should have been 200 milligrams, 2 tablets. So instead of, I just write 200 milligrams, take 1 tablet, but no, it should have been take 2 tablets, right? So there's a process through the drug therapy um, scenario where you can have an error. And it's really important to know when you leave the doctor's office what medication you're taking and why, and what strength. Like, I would write these things down, because unless it's written in the type form, sometimes we decipher your doctor's writing. But if it's written, it's hard to know, because it's written in basically in Latin, right? The sig codes, the instructions are written in Latin, so you have to understand those codes. And that's pharmacy school in some ways, right? That's going to become a healthcare professional. I'm not asking you to do that, but when you're at the doctor's office, write down what the doctor tells you. I am taking this medication for my back, and it's called naproxen 500 milligrams, and I'm supposed to take it twice a day. So when you get to the pharmacy, when the pharmacist says, "Oh, I have this prescription for you," and they say a different name, then you can say, "Oh, the doctor told me I was supposed to get this drug called naproxen." And so that catches things. And I have
Mm.
seen that when people come in and do that and say, "Oh, the doctor told me I was supposed to get a water pill. It's called Lasix." And we're filling Losec because they look alike. Then you catch an error. And this is exactly what did happen, as me being a pharmacist owner happened to one of my pharmacists. There was Lasix instead of Losec. And so there was at the time Celebrex instead of Celexa. Like, so there is very similar names and drugs. And so if you know what the drug is for, and you know the strength and how you're supposed to take it, you double check that when you get to the pharmacy. And you have to tell the truth too. You have to say when you go to the doctor's office or the pharmacy, "Yeah, I don't take that medication," right? We see that in high blood pressure. "Wow, you're on 3, your blood pressure is still high. We're going to add another one." No, just say, yeah, I don't take that one. It makes me feel sick. I don't like it. It's too expensive, whatever that reason is, because then things can be adjusted. There's a situation that happens, you go and you get the help at that time, but then the treatment plan doesn't stay the same throughout it all. So when you start a medication, there's going to be some side effects. There's going to be things that's either going to work or not work. So then you got to go back and you got to figure that out. Or you got to think to yourself, is it this medication that's causing me to have a bad headache? I have headaches all of a sudden. So instead of adding your, ibuprofen or your acetaminophen for your headache, find out if it's because you didn't take it with food and that would decrease your stomach ache or your headache. So there's all these details that go into it. And I call them the rules of medication, but there's all these details that prevent situations from getting worse for you. And what it comes down to, again, those three pillars: communicate, ask what's happening, and then write down your information. And then when you go to the pharmacist, communicate what you know. And then afterwards, keep communicating and understanding where things are going. Because sometimes we do this, right? Like the prescription will be written because we think it's for that reason. Then we see, oh, okay, well, no, your stomach acid isn't working, kind of like what happened with me. Well, we think it's indigestion, we think you have heartburn, so we're giving you that, but yet I still passed another stone a week later and it was just as horrendous, and Pink Lady wasn't working. So sometimes we know, oh, okay, we got to shift because this, what we thought, isn't working because we've tried this route. So that's why it's a journey. It's not always black and white. And it's not black and white because medicine is not only a science, it's an art, right? We've got to figure it's a detective work. So the more information, the better.
Exactly. And I love the idea of journaling. And I love that the journal should start in the doctor's office. We know that at best, you're going to forget 25% of what you learn at the doctor's office. It's probably going to be even more than that. And so when you write it down, you're kind of fact checking your memory too. So you can then use that with the nursing staff or the medical assistant at the doctor's office to make sure that you're understanding what you're supposed to be doing. And you can use it at the pharmacy. It is just really helping you figure things out at every step of the way to keep yourself safer. And that is so critically important. Is there anything else on the topic of ACE, of this framework for safety, that you really want to communicate to people so that they can advocate and show up the best way possible for themselves in the pharmacy, in their doctor's appointment, so that they stay safe and that they get the most out of their medications as well?
I think it's really critical, like you said, the journaling piece. I think it goes through the whole thing. Before you go to the doctor's office, write down your signs and symptoms, write down the severities of that. So I have a headache um, once a month. Okay, how do you know it's once a month? Do you remember every time you have a headache?
Right.
Right? We go to the doctors and they're like, so how often have you had the headaches? I
Mm,
think
yeah.
a couple times, right? So look at that conversation versus, yeah, let me look on my calendar. Yeah, I had 3 headaches on this week. And then if you write that down, and then you start thinking to yourself, well, what was the circumstance around that headache? You do your own detective work. What happened? Was I didn't sleep well the night before? Like what? Try and put together some pieces for yourself. Then if you go to the doctor's office with your questions written, because healthcare is such, there's a hierarchy in some ways of how the process works that isn't always in control of the healthcare professionals. A pharmacy fills so many, and that's how the corporation wants it, of prescriptions. So when you go to the doctor's office, you're probably looking at a 15, 20-minute appointment. Have your questions written out, because then you have your signs and symptoms, you have your questions written out, you get the answers, you look at the treatment plan, you advocate for yourself in saying what's going on, what you would like as a result of what's going on. Because if the doctor says, look, we're going to send you for this test, we're going to do this, we're going to put you on this medication, you ask about the medication, you have a say, right? Like it's a discussion, it's a communication. And you can correct me if I'm wrong, but I know, working with physicians, everybody, all the healthcare professionals, wants what's best for the client. That's the whole point of becoming a healthcare professional. We want to solve the issue, we want to help. So if you can bring that information to us, that journaling is incredibly important. Then when you leave, do your research. That's the E part. Understand the risk versus benefit. As you said, the physicians will provide you with that information. They tell you the risk versus the benefit, but then you yourself think about it, because your life situation isn't lived by the doctor. They don't go home where you go home. They don't have your spouse. They don't have your children. You have to see if what is being explained in the treatment plan works in your life. And you have to be honest and very truthful and open with your physician to say, yeah, that would not work. I'm, on my own, I can't be falling asleep at 8 o'clock at night if this drug is going to make me tired, whatever that looks like for you. And so that open communication also is very important. Then when you go to the pharmacy, and if you're going to pick up the medication or you're going to the physiotherapist, you have to still do explaining. You still have to advocate and explain what's happening. And when the physio says to you, go home and do 15 exercises every day for 4 hours, you might turn around and say, that's impossible. I won't get that done. Like, be honest, like, oh, that looks great, but that's not going to happen. I work 12 hours a day. I can't be off my feet, whatever that is. And so it's a combination of those three things that are really important. But I think it comes down to knowing that you're in control of your healthcare is the mindset shift. You're seeking help by healthcare professionals, by the experts, but the experts can guide you, but they can't make you do it, and they can't tell you what is best for you. You need to make that decision, right? That's where we have consent. So you agree to do this, you agree to do this. It's because you need to be a part of it, not being told what to do, but rather being advised what to do, and then you need to be a part of it. It's no different than if you're going into a bank and you're meeting with investors, or any other situation. When you're going to buy a car, you're doing the research to see what you like, then you're listening to what the car, you know automobile reviews are, and you're listening to other people and what's happening with it, but you ultimately make the decision to buy the car. So you are ultimately making your health decisions. And that's really important. You need to be in control of that.
Yeah. And I think when we fully embrace our role and take on that empowerment and responsibility, that helps with the errors part too. Because let's say we are avoiding the evening dose because maybe it makes us too alert at night. So we're taking the morning dose and not the evening dose because we can't sleep after. Or conversely, someone started us on a medication to help us with one medical issue, but it's making us too sleepy during the day. So we're not taking that, right? So if we are making those choices that may make sense to us in the day in, day out of our experience, but we're not documenting that, we're not communicating that and being honest about it because maybe we feel shame about not following instructions, right? We all have all these limiting beliefs that can set us up for failure because we're making decisions out of feelings of shame or unworthiness, when at the end of the day, come back to the main issue, which is that you are the expert in you. So if something doesn't work for you, you have to communicate that, because it could be a simple solution of, okay, we can switch that medicine. But if we are altering how we are taking medications, it could be a big issue for your health and a big safety issue. So that communication piece is key. And I wanted to bring up something that I really like to do with patients when starting a new medication, especially a medication that there is a big issue with, potentially withdrawing from it, or when we need to be really, really careful about stepping up on the dose, something like baclofen that we want to go up slowly on and go down slowly on if we're tapering off of it and not miss doses and not take too much. I always make sure to write out a plan, and depending upon what the patient needs, even have a checkbox next to like AM, lunch, PM, because you also have to give yourself the grace of knowing that when you start a new medication, it's like a new habit, right? When we start something new, we forget to take the medicine, we are busy, we're not used to it, so it's easy to forget. So when you're starting a new medication, putting out AM, afternoon, PM, depending upon what your dosing schedule is, or every PM, and making sure you're checking those boxes, keeping that paper with you so that then when you're saying, well, the medicine's not working, you can actually take a look at your schedule that you've written out for yourself or with the doctor and say, okay, maybe it's not working because I tend to miss
Mhm.
X amount of doses every week. Which doses am I forgetting? Does this mean that really this isn't the right drug for me? Is there a different way that we can work out this dosing schedule? So that communication piece, leave the shame at home. It really is irrelevant. Let's figure out how to make this medicine work for you because it's working for you, not you for it.
Right. Well, we had a situation where a young 22-year-old ended up in a merge with really, really low blood sugars. And there was a situation where it was like, well, what's happened? Right. But he was a type 1 diabetic and, you know, just did not follow the insulin schedule because was working and decided, oh, I'm just going to double up on my insulin. It'll be okay. Ended up in a merge and he's on a construction site. So
Mm.
it is really important to follow these rules. And if you can't, that's okay. The issue becomes when you don't follow the rules and don't say anything about it, or if you change the rules and don't say anything about it, because it's really important. I'm going to say it's like a car. When there's a stop sign and you don't stop, you might get away with not having an issue that time. But at some point, if that's how you're continuing to drive, you are going to have a car crash because all the rules in driving a car, there are rules in medications. And it's very similar. You might be okay for a bit, but at some point it might catch up to you. And likely with medications, it does. And if you're being monitored, we'll catch those things. So instead of, trying to say, I'm going to try this, I'm going to see how it goes. If it's not going well, have those discussions. Go to the pharmacy and just be like, I can't take this 4 times a day. There's got to be something else I can do here. Is there any way to change this? I mean,
Mm.
this is too hard for me to remember to take it before bed because I do this, this, and this, or I can't be sleepy in the morning. I've got to work. I'm with heavy construction, or I do this. That is invaluable information again, because then we can shift, we can pivot. Trust me, there's never a hard and fast rule when it comes to medications or that you have to do it a certain way. There's lots of options. We're lucky in that way. And sometimes it can also be we're not going to start on medications. We're going to try prevention. We're going to try diet, exercise. We're going to try other things first before we start the medication, or because I can't afford the medication. So there's no point in taking the prescription from your doctor's office and never filling it. In a lot of ways, you might not know it's not going to be covered or that your insurance isn't going to cover it, but the minute you do, go back and just say, look, I can't afford this. It costs $1,200 a week. It's not something I can afford. Well, that's okay. Like, there could be different ways to approach that. There could be a rebate. There could be supplies that the doctor can get from the drug company. Like, there's different ways. So there's always a solution to the problem in healthcare. But if we don't know it's a problem, we can't find the solution, and that can lead to errors.
Exactly. And I think it's important also to say, because we talked a lot about, starting a new medication and maybe it's not working and we're not communicating that, and that can lead to problems. As a physician, it's also really important if everything's fine and you're on a medication regimen and all of a sudden things aren't okay, to communicate that to your pharmacist, to your physician, because I've certainly had situations where someone called in having a drastic change in their health and saying, that's really funny. I haven't changed my medicine that's going on. But as a physician, as a pharmacist, oh, okay, I know you're on this medication that's renally cleared, or in other words, metabolized, broken down, and gotten rid of through your kidneys. And I know that you have, let's say, these risk factors for a change in your kidney function, or I'm just going to check a kidney function test to see how this is going, because this medicine that worked perfectly fine without side effects when your kidneys were fine if your kidneys aren't fine, that could cause these symptoms. So having a really, really open road of communication is so important. Even if you're doing well with your medicines now and you're taking them as prescribed, if something's off, just communicate it, because we are here to help you and keep you safe.
And I think, part of it is sometimes we feel like if we're not in what we call the psychological safety space to have
Mm.
those discussions, we don't want to have them. If you sort of feel like you're being shunned for saying something or asking a question, that's when I almost think you should be even more vocal. It's kind of like if someone is trying to say, no, 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 it's okay, just follow this, it's going to work out. That's when you have to say, well, what would you do if you were in my shoes? If you were in my shoes and didn't feel comfortable with this, would that be the right approach still to take if I said that to you? Or is this really necessary? These are some of the words and the sentences that I would use. Is this really necessary to use this? Is this treatment plan really necessary? Do I really need surgery? Would you do this if you were in my shoes? Because, sometimes as even a pharmacist, if someone's coming in and there's like, would you take this drug? And there's some situations where I was like, I don't know, like I don't know everything, but let's sit down and have a conversation. And then I could advise and say, well, look, there's option A, B, and C. Your physician's obviously chosen this route. If you have concerns, let me talk to the doctor or go back and see the doctor. Because sometimes as pharmacists, unfortunately or fortunately, we get information that the physician doesn't get. And so when we get that, that's that extra piece of knowledge that the physician needs to know. And then sometimes if you're afraid or not sure how to communicate it, use another healthcare professional to help advocate for you in that regard. And I've seen it too in the hospital where nurses are the person. We won't say anything necessarily to the doctor, but we're going to say something to the nurse. Or sometimes we don't want to talk to the nurse. We're going to say something to the doctor, right? Doesn't matter. Nobody gets offended. The point is advocate for yourself at whichever angle you feel comfortable. But I think, it's that whole shift, even as healthcare professionals, that we know that the system is overwhelmingly difficult, more difficult than it was when I started 30 years ago. There's that many more medications, there's that many more policies, there's that much more, yes, technology, but every time you have a piece of technology, it can, shut down, or there's more to learn based on that piece of technology. So there's all these extra complications. So when we have patients who are actively involved, it helps to reduce that burden, but it also increases burden. And so as healthcare professionals, we have more chance of error because of the extra that's going on in our lives, right? In the sense, and you have a lot to do with healthcare being a business and things shifting where maybe 20, 30 years ago, it wasn't as prevalent, but now today there's a focus on that. There's a lot less independent pharmacies, more corporations, more publicly traded corporations, hospitals, that kind of thing. So the focus sometimes shifts and it's out of the control of the healthcare professional, but it can cause an increase in errors based on that environment. So there's so many complicating factors. And I think what I still go down to and boil down to is the more you document, the more knowledge you have, and the more knowledge you give, the less your chance of error.
That's so beautifully said. And I just keep thinking about the safety net, and especially in outpatient medicine, where you may only be spending a significant amount of time with your doctor or with your nurse, and then you go with your prescription to the pharmacist. That's your next line in this safety net. And if you call and have a question, that's just a continuation of the visit. Don't feel like it's problematic or an issue or kind of a squeaky wheel syndrome issue. At the end of the day, we as doctors, we know the hand on the doorknob phenomenon, where we may spend the entire visit with you discussing ABC, but they're not really the main issue. And then we go and we put our hand on the doorknob and we say, which you shouldn't do. You shouldn't ask if there's anything else someone needs with the hand on the doorknob, but we all know that that happens. And there's something about that last moment of, oh gosh, this is the last moment I have to get this off my chest, to share this really important thing, that sometimes most important things can come out that really we need to investigate or we need to understand to make sure that we are providing the best care and the safest care that we can. And if we miss that hand on the doorknob moment and there's more that needs to be discussed or understood, then at your pharmacy is an excellent place to be kind of the next link in the chain of safety and healthcare. So I love that you discuss that and advocate and encourage patients to use that connection and use the expertise of the pharmacist and their ability to call, because they certainly do call physicians and nurse practitioners. And that's a wonderful way for us to stay up to date on what's going on with our patients and make sure that we are providing the best care that we can. Many of us, when we were training, really loved the time when we were on hospital teams where, the nurses and the doctors and the techs and the pharmacists and radiology, we were all working side by side. And it was so easy to communicate these things and learn from one another. And in the outpatient setting, that connection can seem weaker and we can be more disconnected. So when the pharmacist calls a physician, it's actually a great opportunity for us to learn and to connect. So never feel like you can't do that, because frankly, I think most of us really appreciate that opportunity to connect and make sure that we're doing the right thing by our patients.
And I think it goes the other way around. When physicians then give us the information, then we as well, with our knowledge, because then we can help our patients understand a little bit more too, right? And I mean, listen, I, for me personally, as a pharmacist, when I go see the doctor, especially with my kids, I don't remember anything. I don't even know that I know what the drug dose is, because you're so focused and you have this vulnerability and this fear and anxiety and stress. And yeah, knowledge just escapes me at that point. So I rely on the doctor's information. I am critically asking the right questions, but I'm critically listening to, okay, what do I have to know? And then walking out of there and really understanding what I have to do. So when you leave that office, it's, we as healthcare professionals have the same feelings as any patient because we become patients at that point. I'm not a pharmacist going to see the doctor. I'm me, Lydia, the patient going to see the doctor with an issue, or my son. And I don't know what the result is. I have an idea maybe from my training, but I don't know. And so, we talk about healthcare being a different language. So when a physician is explaining something to us, even as a pharmacist, I can then help the patient. And, that interaction equals better patient care because the pharmacist and the doctor both learn things together about the patient. And, it's happened where I'll call a physician and I'll say, this kind of doesn't make too much sense. I don't quite understand. Normally we dose it this way. And the physician will say, oh, yeah, well, we tried that. We did this. Da, 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 da. And then you're like, got it. Okay. And then you go back. Or you might turn around and say, oh, yeah, but did you know that they're also taking St. John's wort? And the physician didn't know that. And so then it's like, oh, we can't really use this one. No, we really can't. Let's switch it to this. So more information equals better care. That's the main theme to all of this, and really understanding the risk versus benefit, because what could help me might not necessarily help someone else. And that's where physicians are, the best at their job because they're the diagnosers. Pharmacist has an idea, a nurse has an idea, but it's the physician who can touch, feel, do the labs, read the labs, the diagnostic testing, know which diagnostic test to order, know how to read those, really understand the complete picture. I mean, you're talking about years and years and years of study. And yes, there is expertise that as a patient, we're fortunate enough that we have the ability to go to the experts. But we need to, as patients, rely on that expertise and that information and take it back and apply it to ourselves. And that's the biggest message that there is, misdiagnoses happen, but it's not always just because a physician didn't catch something. It's sometimes because it's not clear at that point, or the medication that they're taking is masking something, that's underlying that can't tell because if you have a stomach you have cancer, but you're taking a medication because the symptoms presenting as heartburn. We're going to give you something to solve the heartburn. Well, the stomach cancer maybe doesn't, show up without a symptom later of, blood in the stool or whatever that looks like, tremendous pain or cramping. And that's the continuous process. That's the journey that I'm talking about. You can't just give up in advocating, because we put you on a treatment plan, we think you're good, and then if you're not, you need to go back. So even myself as a prescribing pharmacist, I had a lady who had described all the symptoms of a urinary tract infection. But when I asked about, other activities in her life, I decided, okay, I think I need to test you for some other things here, because they can kind of look like a UTI, like a urinary tract infection, but I'm not sure that you have that. And so testing everything, when she came back, it was something completely different. So that's where, yeah, you might know your own body, you think that's right, but listen to the experts, because sometimes that diagnostic piece is really important to rule out other things.
That's so important. And it really brings to my mind when we talk about a diagnostic investigation and we talk about a patient examination and the verbiage behind that medical jargon is we are trying to get information and make decisions based on the information we have from the patient, as well as the information that we've garnered, as you were saying before, from our education and our years of practice and the ever growing amount of data we have about all these different ways that unfortunately our bodies can have issues that need to be handled by our medical professionals, physicians, physical therapists, through pharmaceutical means, etc. And it's really important to just be really open with how you are experiencing those symptoms, because as you've said, we may have you on a medication for one problem, a new problem starts and it's masking that. So being open not only to reporting and being honest about that and what you're experiencing, but also being understanding of it's an ongoing investigation and we may have to edit things. I think that is really key and important, and the willingness to try new things. But when we're doing so, as we've spoken about before, making sure that we're following the instructions of the pharmacist and of our doctor to say, okay, well, if we're going to change this medicine, we need to wean off of it. We can't stop it suddenly. Those sorts of things to make sure that we are staying safe on that journey. I wanted to discuss, now that we've really talked a lot about how a patient can be empowered and the responsibility that they have to take part in their care and how they're taking medications for their safety and benefit. It's also really important for us as people who are practicing medicine, who are pharmacists, who are therapists, to understand that errors happen on our side of the table too, and for us to be honest about those, evaluate them in an ongoing manner, and edit our processes, improve our processes so that we are improving patient safety. I know there are studies that show error percentages from 5 to even 25% on the front of once medications are dispensed in the pharmacy. There's a high potential risk for errors there. So how can we, as staff in a hospital or staff in a pharmacy, work to get away from this culture of shame and not wanting to have made mistakes, and instead get to a place where we can acknowledge that these errors are happening and actually do something about it through reporting and changing our systems and how we respond to them?
That is so important, because we talk about, like you said, from the patient advocacy part, but there is also from the healthcare professional advocacy part. So errors happen. And if it happens in a pharmacy, it depends really on the culture, the corporate culture. So is there a culture of safety where reporting an error doesn't equal losing a job or going to jail, or, the nurse that made an error at a hospital and now is being potentially sent to jail? Who would want to report an error in those circumstances? I'm, like, in any situation, you drop a glass and you're working in a china shop, if you're going to be going to jail because you dropped the glass, then it's an issue. And I know it's not in comparison to someone dying. I'm not unaware of that. It's 100% that. But what I'm trying to say is it's our job not to create an error. We are humans. Simply being by human, we're going to make an error. Then you add all the other factors that go into making errors that need to be mitigated, but aren't at this point. And we saw that in the US. The hashtag pizza's not working, pharmacists walked out because they were in such an environment where it was impossible to not make an error when you have reduced staff and so many people and so many prescriptions to fill and so less time. You become automated in what you're doing and you don't remember what you're checking anymore. So there's, that. And then when you look at like an airplane pilot, they aren't allowed to go to work unless they sleep so many hours. There's no such rules in healthcare. So, which is crazy to me, but it's true. So when you're looking at errors, I think the real important thing is, as a healthcare professional, I was taught very early on that an error becomes a grave mistake if you don't say something about it. And there was a situation where one pharmacist that worked in our town, in the sense, gave a child medication where she mixed, because you have to mix the powder, and she put methadone in it rather than water. And so the child stopped breathing and was in a emerge. And they called the pharmacy because the mom brought and said, this is the only thing, and said to the pharmacist, is there something in this amoxil somehow that's not working for this child? And the pharmacist realized, oh my gosh, I mixed it with methadone because it was put in an unlabeled jar. And she went back and she was just like, this is methadone, not water. She realized it. She said right away, that's methadone in there. So then they could save the baby. If she would have not said anything, then that baby would have died. So I learned early on that saying when you make a mistake, even though you have pits in your stomach, you feel terrible, you have an entire panic attack and sweat. Well, at least I know I do, that you realize, oh my God, I made an error. The first thing you do is call the patient and say, have you taken this medication? What have you done with it? And you resolve it and you say, no, do not take that anymore. That strength is the wrong one. That dose is, I put, take it 5 times a day rather than 5 times or once a week, right? So there's all of these things that can happen. Identifying the error is really important. When the patient comes back and says, these don't look like the other ones I got, I I think most pharmacists would be like, let me figure this out for you. There was a situation when I was working at a company where the pharmacist said to the patient, they said, well, I have a pink pill. And they thought it was warfarin of one strength, but the peach one was what they were taking. So really, then afterwards, it was like, she's not doing well. Well, why is her INR, which is checking the blood levels with that drug, so out of whack? Well, because she was taking the wrong strength. So it was like, okay, we got to get to the bottom of this. And that's the key thing. Healthcare professionals need to get to the bottom of it. But the more we discuss it, then the less the errors happen, because if they're reported, you can take the information and you can know how to no longer make that same mistake. If it's not reported, the errors just keep happening in the same way to more people. And that's the piece of safety that needs to stop. Right now, we don't have a lot of states in the US or provinces in Canada that have mandatory required reporting by pharmacists when errors happen. So imagine that. Like, just imagine if a plane crashes, the airline company wouldn't have to report why. We would never in that industry allow such a thing. But yet in pharmacy, in some medical institutions, we don't have to required to report the error. And I think that's a disservice to everyone, including the healthcare professional, because if I knew what happened somewhere else, I could keep an eye out for it. There was a situation where, sound alike, look alike. So there was errors that happened with that. That was widely reported because deaths happened. And then we had to change our policy where if there was two bottles that looked the same because the manufacturers made it and there was just a tiny little two instead of a one to separate the bottle, instead of one bigger, one smaller, it had to be put on a different shelf so that we wouldn't grab the 200 versus the 100 milligram bottle. So it's really important that as pharmacists, as healthcare professionals, when a client says this doesn't look right, that we take that to heart and we look at it and then admit. The other part to the healthcare professional piece of it is, a lot of times we're told, don't tell the patient you made a mistake or that's not the right thing to do. I disagree with that. I think as a human being, to another human being, it's really important that we recognize what's happened and we explain, because there's better communication with that and there's better closure to the situation. Nobody wakes up in the morning in our job to go hurt someone. And if they do intentionally, they need to go to jail, right? But if you're a healthcare professional, your job is something that you've prayed for and you want to do the best. So if something happens, there's shame, there's worry, there's stress, but there's also a decent person inside of you that is feeling terrible that this happened to this person because of your actions. So you want to try and reconcile that and have an ability to apologize and have an ability to have that conversation so that there can be some resolve for your own life, because it stays with you the rest of your life. And you know that you made an error and that sits with you the rest of your life. It doesn't go away. And I know, like, every time I pick up, one bottle in particular where I know I made a mistake, I don't even want to dispense that drug because I always get scared of it, right? But I've been fortunate because I didn't have, and I'll knock on wood, I didn't have a terrible situation happen. But it doesn't matter at what degree the error happens; it's still an error. And that's ultimately why I became a patient safety officer, was because when I owned and operated, we had a lot of medications leaving our drugstore. We were servicing a huge clientele. And it was really important that I set up my pharmacists for success, that there was a way to catch these things, and what best practice and what best process could we do for our pharmacists. And part of it was reporting. We had to report. We had to sit down once a month with every single facility and we had to review errors. Because what happened? How did the nurse make the error? What could pharmacy do so that alerted the nurse when they were giving the medications to reduce the error? What did pharmacy do when it left the pharmacy that caused the error? So it's really important to understand healthcare professionals should be reporting because it helps us. It's not a detriment to us. And the whole idea of healthcare professionals not making errors and hiding that, that's a disservice to everyone.
Exactly, exactly. And it is so important that we learn from these mistakes because, again, as we started off this segment of our discussion, we know they happen, right? Statistically speaking, they will happen. They will happen less, though, if we respond to them and we work on those processes and we find the little blips in the system that we can improve for next time to improve patient safety. And I think it's interesting because when we talk about just general mindset and how we interrelate with others, when someone made mistakes with us, because of course we've all experienced people not handling us with the greatest care, making mistakes, whether intentionally or unintentionally, when they pretend that everything's fine, that feels horrible and it does not help make the situation better. It makes it worse. Whereas when they're honest with their mistake and they show that they do want to repair that, not only does it help with what happened, but it can actually strengthen our bond.
Mm.
And when we as a team in healthcare are honest about mistakes, that can strengthen our bond and our ability to efficiently and effectively and compassionately perform as a team in the healthcare setting. Those of us that have experienced medical errors or have had complications from surgery, for example, if you had the experience where you felt dismissed or you felt like the provider was uncomfortable discussing that with you because it seemed like they were allowing their shame to come in between an honest exchange with you. Not only did that feel really bad for what you've experienced, but that can follow you into your future and how you're experiencing your healthcare and how safe you feel. And like you said, if you're on the other side of that and you're the one that had the error, every time you go to do that procedure, it's there beside you. Every time you touch that bottle of medicine, it's there. So, as much as we've been conditioned to fear failure, we know we're going to fail. And I love your focus as a patient safety advocate to say, no, we need to be honest and upfront about these failures so that we can actually leverage them as ways to make the system safer, because we know the system needs to improve, but it's only going to do so if we're honest and we are really facing these issues head on.
And I think it's really important to know, with that open and honest discussion, there's going to be things that need to be mitigated based on that error. So, like the situation where the baby's in the merge and they're on methadone, now there's an entire process that can now happen to heal that problem, to fix that problem because of the honesty. So it's really critical to have these open discussions. It's not easy. It is not easy. I can remember shaking, like just being distraught about having to tell someone that, you took this wrong because we put it on the label wrong. And it's not an easy discussion to have. There's no happiness towards that. But by doing that, you're right. There's a trust that's being built that, thanks for being honest. I didn't know. I thought I was going crazy with this medication. I thought something I was doing wrong because I was following it and it's not helping. And so then there's also this part of the journey that now can get to healing, right? And so it's not just the patient not following the rules, in the sense, if the healthcare professional isn't following the rules and doing things correctly, which we know happens, then that's where that meat of error happens. And that's where both parties have to communicate effectively and honestly. Not just the patient has to be honest, the healthcare professional has to be honest as well. And saying, we tried this treatment plan, but unfortunately, I missed this. And that piece of information probably could have led me to this. And this has happened for nurses, pharmacists, physicians, specialists, surgeons, OR, anesthesiologists. It happens everywhere. And we know that because the statistics are there. And that's why we're telling patients to be encouraged to be their own advocate and to empower themselves. Because unfortunately, and I don't know how else to explain this, but our systems have become extra complicated and harder to work within. And so our error rates are going to go up if we don't start this whole looking at this entire healthcare system, no matter where in the world. Doesn't matter where in the world. Errors are, high in the cause of death and cause of harm for patients. It's errors, it's high up there. It's like the fourth leading cause. There's World Patient Safety Day now from the World Health Organization. Didn't exist 20 years ago. So we really need to all collectively, patients, healthcare professionals, providers, owners, operators, corporations, all have to put care in the beginning of that and honesty.
Lydia, thank you so much. That is so incredibly important and empowering to let patients know that yes, these errors happen. And yes, we as healthcare providers are doing what we can to try to mitigate them and improve our systems. But we need you to partner with us. And you do have this power. And it starts with communicating and advocating for yourself and being a part of that educational piece. I so appreciate that the message you are sharing with everyone. Where can our listeners find out more about your mission and what you're trying to teach?
Well, I've got the website. I'm starting my social media journey. I think I got to do some dancing on TikTok to get the message. I'm probably not as entertaining. but that's kind of I've got my at Lydia the RX on TikTok that I'm sort of starting, and at Lydia Molinara on Instagram, and plus you can find me on my website, which is www.lydiamolinara.com, and my TEDx talk is on YouTube as well.
Yes, and everyone, please go listen to that. It's incredibly impactful, as well as other interviews you've done where you've shared some really heart-wrenching stories about experiences that patients and families have had because of medication errors. And again, this isn't about shame.
Mm.
This is about making sure that we all feel empowered and safe to do what we can to improve these systems, improve how we are interacting with healthcare professionals, improve if we are on the other side and we are in healthcare, improve how we are showing up and managing medication and its administration to keep patients safe. So thank you so much for the incredible work you do and for being here to talk about it on the show today.
It's been a pleasure. Thank you so much for having me.
Thank you so much, Lydia, for being on the show today. And as I mentioned before, everyone go check out Lydia Molinara's amazing TED Talk and everything else that she shared, including her podcast and her Instagram and TikTok account. We will be watching as that grows. And we are so appreciative of how she is sharing this really important message about patient safety. Thank you so much for being here, storytellers. Make sure you subscribe to the show so you don't miss the exciting episodes we have coming up in the near future. As always, stay safe and take care. I'll talk to you soon.